The use of valid health screening tools for early detection of diseases and interventions can potentially improve patient outcomes and quality of life. There are several health screening tools that are available. The patient population under care usually determines the most appropriate screening tools to be used. As part of the initiative for health promotion and disease prevention strategies, routine screening for specific diseases has become part of the healthcare practice. The U.S. Preventive Services Task Force is an independent panel of experts in primary care and disease prevention who systematically reviews the evidence of effectiveness and develops recommendations for preventive services. The CDC, the Healthy People, and the U.S. Preventive Services Task Force as some of the healthcare leaders who offer evidence-based, age-appropriate screening tools and treatment options. They recommend lung cancer screening, aspirin use to prevent cardiovascular diseases and colorectal cancer, abdominal aortic aneurysm, gonorrhea, and chlamydia screening are all some of the examples of the various screening tools that should be used by the healthcare professionals as recommended by the U.S. Preventive Services Task Force. In addition to the recommended screening, the 5 most relevant screening tools for psychiatric nurse practitioner would be the utilization of the PHQ-15, PHQ-9, alcohol, smoking, and substance involvement screening tests, medical screening short form, screening tool of older person's prescription, and screening tool to alert doctors to right treatment. The PHQ-9 screens for major depressive disorder and other depressive disorder, and as well as depression severity. The PHQ-15 screens for somatic symptom severity, as well as the somatic signs and symptoms and physical symptoms associated with somatic disorders. Alcohol, smoking, and substance involvement screening tests. It assesses for all levels of the problem that's and risky associated with risky substance use in adults and offer solutions. It is a brief interview of how much alcohol use, as well as tobacco and substance abuse used by the patient. The screening does not involve medications that are routinely prescribed, but these are medications that the patient takes that are not prescribed. Medical screening short form. It screens for both mental health and physical functional ability. It also assesses for pain and general health perception and as well as the mental health and physical and social functioning as a whole. Screening tool of older person prescription. The criteria for review incorporate the appropriateness of medication use in older adults, medication reconciliation, polypharmacy use of multiple medication to treat various chronic diseases, the drug-to-drug interaction and drug-to-disease interaction, the pharmacokinetics and pharmacodynamics in older adults. Screening tool of older person prescription also deals with the age-related physiological changes in older adults. It reviews the greater risk of adverse drug events in the older population, inappropriate prescription in major causes of adverse drug events in the older population. As a result of this, the BEAR criteria was designed to reduce older adult drug-related problems. The BEAR criteria potentially reviews the inappropriate medication used in the elderly population. It looks at the potentially inappropriate use of medication and how to avoid certain medication for certain diseases in the older adult, and medication to be used with considerable caution in the older population. Medication combination that may lead to harmful interaction, and a list of medication to be avoided altogether in the older population. Screening tool to alert doctors to right treatment. These screening tools takes into consideration the holistic and comprehensive assessment of all medication histories, the older population physiological assessments and drug interaction, and it alerts the providers to appropriately prescribe medication and as indicated. In conclusion, early disease discovery and treatment can improve the patient life, can improve patient quality of life. Many individuals that suffers from both psychological and physical disability can benefit from use of various health screening tools. It is important, therefore, to use the most appropriate screening tool for accurate diagnosis and treatment option.